Nancy, and welcome to Coffee with the Cardinals. My name is Kathy Current, and this is Cheyenne Sawyer, and we will be your morning news anchors on this fine Monday. Oh, this weather is brutal, isn't it, Cheyenne?
Oh goodness, it's just terrible. That snow on Saturday just came out of nowhere, didn't it?
Oh, absolutely. Anywho, Buck Often will be here with us in a few to talk with you guys about the weather for the upcoming week. In other news, Ball State SGA final elections took place a couple weeks ago, and Elevate took the win over the new Empower crew.
Oh, good for them. I hate to share my personal political views publicly, but my vote was with Empower. They had such great ideas, and that Secretary Aaron Byrne can rock a blazer, let me tell you.
Oh, absolutely. Now, before we get into our morning weather with Buck Often, we have an important public service announcement for all of you Cardinals tuning in this morning. A patient with a gnarly cough showed up to Ball Hospital, and it turns out that Mycobacterium tuberculosis is the culprit, popularly known as TB.
Holy ravioli! That is not something I want to catch. News anchor Buck Lofton is at Ball Hospital this morning with one of the nurses on staff to help shed some light on exactly what TB is, what symptoms to be cautious of, and how to treat it. Over to you, Buck.
Thank you, Cheyenne. Good morning, Cardinals. I'm Buck Often, and I'm out here at Ball Memorial Hospital with Nurse Amber Hummel, who has been taking care of a patient with tuberculosis for the past 2 nights. Amber, can you tell us a little bit exactly about what tuberculosis is?
Of course, tuberculosis is extensive necrosis of the lungs due to our body's immune response to Mycobacterium tuberculosis. This bacteria enters our bodies and releases antigenetic material and reacts negatively with some of our best fighting white blood cells.
How exactly does this bacteria work or get into our bodies?
Well, tuberculosis is an airborne disease, which means the little particles traveling through things like coughing, sneezing, or yelling. The little particles travel through your nose and mouth and eventually reach your respiratory tract and lungs.
That sounds like it could be pretty contagious. How do you protect yourself from breathing in these particles?
Oh yes, TB is definitely contagious, which is why we wanted to send out a public service announcement. The patient is placed in airborne isolation, which means anyone who enters the room has to be specially fitted for a mask to protect them.
I can't imagine that would be very comfortable. Would you mind sharing with the Cardinals here today what exactly happened when this patient came to you?
Well, the patient came in coughing uncontrollably with a bunch of phlegm and blood. Just based off of that, we knew we needed to get him in isolation.
Golly. Well, an uncontrollable cough happens from time to time. Just last week, I was hacking my lungs out, but I didn't have TB. When do we need to get worried here?
Well, the patient presented with a bunch of other symptoms as well. He was drenched in sweat, had a high fever, and complained of anorexia, unintended weight loss, and overall malaise for the past several weeks. These are all signs that something wasn't right.
Gotcha. So how do you test and make sure TB is the real deal?
Well, we do a skin test, we do a blood test, and a chest x-rays to confirm our suspicions.
3, 2, 1.
Yikes, that sounds like a lot of work. So tell me, nurse, what's this outcome look like? Is TB just a fancy way of saying death sentence?
Oh no, we catch it and treat it promptly, and then the prognosis is good. It's a good thing this guy got here when he did. We were giving him a bunch of antibiotics and keeping him isolated so it didn't spread. The American Academy of Pediatrics actually recommends a daily antibiotic combination for 6 months and then tapering 2 to 3 times a week for 4 more months. Sometimes we even have to get that infected or necrotic part of the lung out with a surgery.
Whew, that sounds like a lot of drugs. Now what about those guys who don't get treated?
Well, untreated TB can result in death, and it's still one of the top 10 causes of death globally.
Now, what kinds of people are at greater risk from getting TB?
People in underdeveloped countries experience it more than the developed ones, which is why we're a little surprised to have seen it here. Living in overcrowded areas or slums increase the risk. HIV, diabetes, malnutrition, and smoking habits are some of the big-time risk factors too.
Thank you, nurse. That's some very good advice for our young scholars tuning in today. Would you mind sharing some advice with these viewers about preventing TB?
Sure. Since developing countries are at a higher risk, traveling to those countries adds an increased risk. If you can avoid travel, you should try to avoid close contact with known TB patients. There is actually a vaccine for tuberculosis. It is called BCG, but isn't very common in the U.S. since it isn't a common disease here. It's typically for kids in countries vulnerable to tuberculosis or adults who have a risk of coming into close contact.
Excellent advice, nurse. Now listen, Cardinals, next year when you're blowing your parents' money or your financial aid refund on spring break, do not go to a developing country. You can get plenty of Instagram-worthy pictures somewhere else. Okay, so you said active tuberculosis can result in death. Is that the only outcome?
No, it's just one of the most serious ones. Other complications like spinal pain, joint pain, meningitis, and heart and liver, kidney disorders can stem from the tuberculosis.
Of course. Now, a great majority of our viewers are nursing students, probably because they can't sleep because of stress or because they have to get up at 2 a.m. to get ready for clinicals. But is there any specific advice you can share for these aspiring young baby nurses?
Well, these patients need to be in a positive pressure room with airborne isolation precautions. As always, the priority in patient care is airway and breathing. Assessing these patients' respiratory function is the most important focus, and you should always give oxygen and medications promptly as ordered. Teaching is important as well. They should be educated on drinking fluids, clearing secretions, and treating and preventing the tuberculosis.
You heard her, baby nurses. If you have any strength left in you, take out your pen and paper and write that down.
Nursing diagnoses are important here too. Some include ineffective airway clearance, activity intolerance, imbalanced nutrition, less than body requirements, risk for infection, and risk for impaired gas exchange.
That is a message I'm sure these viewers will take away today. Thank you so much for sharing your knowledge and wisdom with us, nurse. Now get back inside and fix that patient. It has been my pleasure to share with you this public service announcement and my fine lips with you this morning. I'll see you after a bit to discuss the weather. Back to you, Kathy and Cheyenne.
Well, obviously we have TB here in Muncie. It's climbing in your nasals, snatching your respiratory function up, and trying to infect. So hide your kids, hide your wife, hide your husbands, because TB can infect anybody out here.
Exactly. According to the WHO Global TB report of 2018, 10 million people developed TB in 2017. Just because it isn't a huge prevalence here doesn't mean it couldn't be.
Well, thank you for tuning in to Coffee with the Cardinals again, folks. We'll be back after the break. On a final note, what's meant TB doesn't have TB if you prevent properly. I'm Cheyenne Sawyer, and this is Kathy Current, signing off.
Slur mess for that too. Okay.
Popularity.
Yeah.